Reminder, please leave your microphones and your videos off during the presentation. Also, if you have questions, please type them in the chat box and I will make sure to relay them to our presenter when we are finished. If you have any other questions or concerns, please type them in the chat box and we will do our best to accommodate. So for our 5th training session today, we have David Klein with Great Plains Housing Authority, and he is going to be presenting on mainstream vouchers.
Okay, well, thank you. Can you hear me okay?
Yes.
All right. Well, today's presentation is on mainstream vouchers. I'm the Executive Director at Great Plains Housing Authority in Jamestown, and our office oversees the Section 8 Housing Voucher Program over 6 counties, and includes having contracts to handle mainstream vouchers. I will say I'm not a total expert at mainstream vouchers, but we are administrators of the program. So I will do my best in explaining the program and try to answer any questions after we go through this. Let's see if hopefully it works here. The mainstream voucher program is a HUD program. The Appropriations Acts of 2017 through 2019 created some new vouchers, and it was the first time since 2005, making $500 million available in new vouchers. This is a HUD program. It's often referred to as MS5, as mainstream 5-year. It's just the coding that they utilize in identifying the type of voucher, but it is a housing voucher program, much like the regular programs. Mainstream program, like I said, is a regular Section 8 housing voucher. It is just identified to a certain population. So it works the same way in that we look at 30% of their income goes towards their housing costs, so their rent plus their utilities. How I explain that to a lot of clients is that, having $1,000 of income a month, be paying $300 towards your rent costs, and we would be paying the remaining balance. There can always, if there are deductions in there, eligible deductions, that may bring that to a different balance. But that's how we explain affordable housing, is at that 30% and using a round number. Mainstream vouchers have to be on the same waiting list as other vouchers. So you would not be having one. And that's one of the I think oftentimes confusions about the program, is that it must be connected as the same waiting list. Special population, there are certain things that HUD requires in order to receive these vouchers. The clients must be disabled, but not elderly. 62 or over is elderly underneath HUD's guidance. If the person happens to be turning 62 while coming onto the program or a month later, that is okay. It is a matter of they cannot be elderly at that point in time. So we try to make sure that at the application that they're under 62. The disabled person does not have to be the head of household. This is the other unique part about this program, is that in order to receive this voucher, it could be a child, it could be a spouse, significant other, that is a person with a disability and not the head of household. The housing authorities may create new preferences for mainstream voucher clients. They may allow portability waivers. And a waiver allows that client to be able to move with that voucher out of the original jurisdiction earlier than other clients. So for example, most housing authorities require that the client live within their jurisdiction for a year prior to any port or move out to another jurisdiction. With a mainstream voucher, that might not be the case. You may want to have the ability to waive that to allow this person who may have various different disabilities to be able to get services or be closer to home, family, immediately rather than causing another delay. And so we look at this as almost like a medical necessity, and that we're able to grant those waivers to help that client. There are some funding requirements. And so when a housing authority applies to receive these vouchers, the funding comes separate to normal vouchers. And so there's always different increments that happen, a lot of different reporting things that do happen with it. So the agencies must track the clients with a special code. That's what this MS5 is for. That is how, it's a special program code that we put into the form that's sent to HUD. But all of those costs must be separate. So it is a separate budget, your voucher program, your normal voucher program. So again, it is separate reserve, separate administrative fees, and those things that are identified differently. And in fact, when each housing authority reports each month on the number of vouchers that they would have mainstream versus other, mainstream is actually a screen lower than other things. It is much like having a portability in or another various other words completely separated off. But they have to, again, those clients are commingled within that waiting list, depending on the preferences. There are some categories, and this is the other thing too that HUD wants everybody to be aware of. So there are 4 types of categories that should be part of how you evaluate if the person is eligible for mainstream vouchers. One is to look at, are they currently living in institutionalized or segregated living settings? So you look at things like state hospital, or were they in a group home setting? Are they in a rehab center for physical disability or anything like that? Those become institutionalized or segregated living. That is a big population we're trying to house independently. Is the person at risk of ending up back in those institutional or segregated living settings? So it might be somebody that is being cared for by a family member, but that family member can't keep them for a long time. And so they're at risk of going back to either one of these types of centers because of the current situations. Are they at risk of being homeless? And for the vast majority of people that households with disabilities, this is going to be the biggest category that you're going to have. Most people that are receiving, SSDI, Social Security, something like that, are not going to have the sustainable income. And so this is where we have the biggest risk, the highest category of being at risk of homelessness. And they're chronically homeless. And we have to follow with HUD's definition of being homeless for at least a year, or repeatedly experiencing a disability condition. So we want to make sure we're following their call on that. These are the categories that HUD has set forth and deemed that these are the most vulnerable people and the uses for mainstream vouchers. So we need to make sure that clients fall into these. Often when we see an application, the person says, well, I'm at risk of being homeless, checks the box, brings it in. They're not understanding that they have to, be disabled, permanently disabled. I should keep track of that, is that it has to be a permanent disability. And so we want to make sure people follow those categories. And also just, as a good reminder too, when we go through this, the other ones that we run into is that a person may be elderly. And this was actually a discussion had this last week with Assistant Secretary Hunter Kurtz from HUD, is the need for those that might actually be over the age of 62 However, the program has always been written at 62 or that elderly status. So if a person is over 62, they will not qualify for the mainstream voucher. There's also some uses here. So we look at a lot of different things with mainstream vouchers, and part of that is to allow a person to live independently and to find their own settings that work best for them. Much like the time when we're talking vouchers, we need to visit with clients about what isn't good access. So it's the physical environment. Does the physical environment in the open market have something that's available, that's accessible if they needed to? Does it have sidewalks, transportation, how close it is to things? Trying to coach some of the clients to understand what their needs are when they're out searching. So the mainstream voucher functions as a normal voucher, and the client goes out to the open market and finds units. They can use, the voucher on anything that is not already subsidized housing or public housing. A housing authority can also use mainstream vouchers for project-based vouchers. So that allows the housing authority to tie some of these into a contract with that developer or that entity. It could be almost like a transitional type facility, or it could be a facility that wants to be able to help a few people here or there. We've had some discussions with other complexes across the state. But this means that the vouchers for mainstream could be used for permanent supportive housing. And this is a good use of those mainstream vouchers. In North Dakota, Fargo Housing Authority has mainstream vouchers, Grand Forks Housing Authority, Burleigh County, Minot, Williston, and Great Plains Housing Authority. These are the entities or the agencies that have applied and received mainstream vouchers. So they would be the ones to contact and taking a look at what is available. Also, if another housing authority is looking at applying for these mainstream vouchers, these are also the entities to visit with about any policies you may need to look at or how to manage the program as it comes up. The biggest thing to understand is what you're looking at with the disability. We have a lot of questions that come across: who is disabled, and everybody has in their mind a fixed person. A person is with disability, but it's different than that. And thankfully, in a way, HUD has some forms that help with those things. So there is a HUD verification for disability, and you can use that form. You can use the form, develop it yourself, and follow the same thing. It is something in which housing authorities can require. So you can require this of any client in order to verify that disability, since that client is asking for a preference or special voucher. You're not asking necessarily anything about it, but you're needing to know, is this disability permanent, and does it fall underneath HUD's definitions of disability? So it is something that you can require. Definitely housing authorities should ask in their paperwork. The HUD form does require that it is a medical physician that signs that. So that's something to understand too. It can be an advocate group that signs off that the disability exists. One of the examples that I frequently discussed with people and explaining this is that it can be something like PTSD. And so it could be, let's say, your veteran service officer signing off that, yes, this veteran is permanently disabled because of PTSD. So, a person using these forms, don't get hung up that that's not a medical provider. Although it does require a signature, it does require that the printed name and a contact be on there. So if needed, you can verify that that person indeed did sign that form. So the HUD form does ask, does the person have a physical, mental, or emotional impairment that is expected to be continued in a definite duration, substantially impedes the ability to live independently? Covers a lot of things. And I really want people to understand it goes through the physical, mental, and emotional impairment. I think that often it does, people have the thought about only the physical, or if it is, mental, that it has to be severe mental illness, and it does not. The verification also covers person with developmental disability, and it goes through a bunch of different questions on that one. Again, this is probably the checklist more so that a long-term social worker or physician might be more knowledgeable about completing, because HUD has some specific questions regarding developmental disabilities. Now, HUD's verification, you can look at chronic mental illness, persistent mental or emotional impairment that limits the ability to live independently. Could the impairment be improved by better suitable housing? Is a person living in a place that is unsafe? And then we have PTSD. And as I mentioned, veterans a lot of times will have PTSD. You might see a person out there that has no symptoms or no physical disability, but as PTSD is there, it's present, it may cause a lot of other issues. We think of that with anxiety, with depression, those types of behavioral health issues. I'm also a person that believes with PTSD that we need to also focus and broaden that as we see people that are, have a lot of other things that come about. It's not just war things, or it can be other traumatic events that may cause that. Again, the disabled person does not have to be the head of household. We look at veterans and veterans' families. I'm also advocating and work with victims of domestic violence. Those families often experience something that is extremely traumatic and stays with them long term. So finding them safe, suitable housing, this might be something much, a program better suited. We work with a lot of behavioral health clients. Our housing authority is directly involved a lot with the North Dakota State Hospital and the psychiatric care and the South Central Human Service Center and the clients that they work with. So we deal with a lot of behavioral health clients and those issues. Trafficking victims are also a bigger type of client that we need to be exploring to help. Their disability long-term, the PTSD there, or emotional impairment there, is something as well that we need to find housing that helps them feel safe and helps them feel good. The other thing too on this, and I did not put this on there, but I certainly will put it out on there. I can send out the form to anybody that requests it. So at the end of the presentation, my email will be up. If you don't have it, please email me and I can send out the form, and I'll send out my final PDF too. Is that disability under HUD does include substance abuse. So alcohol and substance abuse are things covered underneath permanent disability by HUD. Again, a person does not have to be receiving disability. They do not have to be physically disabled. They do not have to be the head of household. You have to look broader at the entire spectrum of disabilities, and you have to have the documentation. The verification is the easiest thing, and it does not get you, too involved with stuff. It does not violate any fair housing questions. You are asking them to verify that disability because they are asking for a special preference or special voucher. Now, one thing that we come across quite often is regarding our clients. The mainstream clients, they're hard to house. They're difficult to house at times. Some of them have burned a lot of bridges. whether it's not understanding policies, being able to keep up on things. The service coordination, I can't emphasize this enough. Make sure you're working with a lot of service providers. That helps keep that person housed. We also know that sometimes they have some criminal history issues. And some of that is related to those behavioral health issues that they may not be fully understanding and aware. So it's something that you may need to look at, how you are screening, how you are providing any types of waivers or reviews on those criminal history policies. And then also some of the landlord screening gets to be really difficult on some clients, depending on how things are approached. I always, the working with casework on the clients, especially mainstream clients, is very beneficial. And it's one to ask about is, are they okay if that caseworker is part of the briefings or part of any of the discussions? So that helps connect that caseworker and that client and helps walk through services much better. If it means getting on the phone and having conference calls with them, do so. That actually is something that is a reasonable accommodation to ensure that those housing services are delivered correctly. Now, mainstream clients are also something. North Dakota has a landlord mitigation fund, opening doors, and that is something that can be worked through with that program through North Dakota Housing and Finance. These are some of the clients that may be ideal candidates. When we look at a mainstream client, in the long term, we're thinking on medical, and we're thinking about that client. I always say we focus on clients. And that focus means, does that client need to move right away without needing that residency? So, is the housing authority available to move that client to another jurisdiction to provide that client safe, decent, functional housing, but also knowing that services might be there, family might be there in order to help that client succeed. That does mean that a person may not need to be going to urban areas. It doesn't mean everybody has to go to Fargo, Bismarck, Grand Forks, Minot. They can be served in their rural locations. Some of this stuff might actually be an area where some new services may pop up. North Dakota is working with Medicaid and providing a 1915I amendment that'll allow a lot of behavioral health coverage under Medicaid. That might open up to nursing homes, helping with some cares, some transportation cares, and other things that may help that person be successful. So why mainstream vouchers? Well, one of the mainstream vouchers, in previous years, several of the housing authorities and North Dakota Housing and Finance have tried to get an 811 program through HUD. And that was highly competitive, but it created complexes. And a mainstream voucher allows the clients to be able to search for their place. It helps some special clients in a different way. So we're able to look at those criteria that HUD sets forth. It may reduce your waiting list. It's a very common thing. Somewhere around 30 to 40% of a waiting list, of housing authority waiting lists, are people with disabilities or families that have somebody with the disability. So it may reduce on your waiting list by taking all those people off and using this voucher and then opening up other ones. That opens up other funding you can use. And I will tell you, in some times, it takes a little time to build, but also that opening up that other funding can also take some time too, because you're building in a way two programs, as you'd be filling a mainstream and normal vouchers. And sometimes that can be a little bit of an extreme work. This is important as it connects clients to the services and the families that they need. Again, that speaks volumes to when you're dealing with a person that has been in these types of situations. And those services and the families are absolutely critical. It's separate funding from the Section 8 voucher. So it takes the pressure off of that Section 8 voucher budget, although it all has to be identified separately. You know that there is a budget. It's not, an unlimited fund. You are allocated X amount of vouchers, X amount of funding. Typically, the funding will run out first before the vouchers. And it helps identify the needs for supportive services. Over the last couple of years, working with Department of Human Services, follows the other groups, we have been working on supportive services and trying to get more of them within the state. This helps us identify those types of services, which may include pre-tenancy and tenancy support services that go along with the mainstream vouchers. And it helps an extremely vulnerable population, one that is at very high risk of being homeless. So the mainstream vouchers help us reduce evictions. They're providing that tenant with housing assistance. It's built in an additional program, so we've got so many vouchers. In Stutsman County or in Great Plains here, I've got 100 vouchers for mainstream that we can utilize. So that's helping us reduce down on a lot of eviction issues, because now it's identifying that person with that special voucher, working with that caseworker to make sure that person stays compliant, works with a lot of landlords in helping things. It has reduced jail time. If a person's not housed properly, they're going to be doing things in which help them be housed or put them in some sort of shelter. We always look at that it reduces healthcare costs too. Overall, having a person be in a good, healthy complex reduces down those healthcare costs. The physical environment can cause a lot of issues and a lot of health issues for a person. So that's less trips to the emergency room, less trips to the doctors and other things. The person might be working or have children, it might be less missed days in school. It also reduces down on service burdens too. Law enforcement, human services, not involved with as many people as this is helping house them. But also on the housing authority side, quite often the people that are mainstream voucher clients are people that are applying and applying and applying and applying and never getting leased up or never getting things completed. And so working with some of them with casework has greatly reduced on that burden on the housing authority that we're not seeing them apply a dozen times in 1 year. This helps clients live independently, and that is one of the biggest goals. We need to reduce down on some of the possible violations that we're, too many people with a disability, or we're saying, oh, we want to have all these folks in a particular building, which becomes a violation, a federal violation. And if the person chooses to live in a certain specific area, that is up to them, but it's a matter of we can't just, hey, here's 300 people we're going to put into one building. That doesn't work. But it helps in many ways. The clients then have that independence. They have a little bit of more knowledge and more pride of having their own home. So how can a housing authority do this? Or what are many different things for housing authorities? Well, the housing authorities must apply for mainstream vouchers, and it is a grant process. I would say compared to so many other HUD grants I have written, the mainstream voucher one is relatively easy, but you have to apply. And there has been some talk of whether or not they will allow new housing authorities into using the mainstream vouchers or only existing ones. Until it's actually published, we don't know. It really don't. But look at grants.gov, keep an eye out for it. housing authorities will need to have the support from local and state organizations. So having some of your support services, your advocates, some of the state services, human services, and others, write letters of support, but also showing them or asking what that need will be. So you can't ask for 10,000 vouchers and your need might only be 10. You have to have a realistic need in there and demonstration that you can, your office can handle that. That is something that you need to visit with very much so about the support organizations. And those letters of support must be something completed and with the application, because HUD does review those. HUD is going to have some limits on some of these awards. That could be a different situation. We don't know. There are some things in which HUD does go through on a grant application, and some of them are that you can't have any current HUD violations of be troubled housing authority. You can't have any outstanding fair housing violations. So it's something to be aware of, but do read through the notices. It's always worth trying to apply and go through the process. So one of the things I've had asked is, if we port a person with a mainstream voucher to another housing authority and they don't have it, then what? Well, that person is actually just a normal port-in. You don't have to have the mainstream voucher program in order to accept a mainstream voucher. It just comes across as a normal voucher, a normal port-in voucher, and the person is moving in. There is a category box to make sure the check, but otherwise on that side of things, it is relatively simple. It's on the originating housing authority to monitor things. So it's not a matter of you don't have it, you can't accept it. It's a voucher. And yes, a person can apply from one housing authority and port to another. As I mentioned, it can be something where the person needs to be in Cavalier, North Dakota, and needs to be there. Or if they need to be in Aberdeen, South Dakota, they can be there. If they applied through a housing authority that's got mainstream vouchers and request the portability, and it is allowed, they can move with that voucher. But they have to be sorted in the same way with that waiting list. So that waiting list sort still plays. And that's something for people to make sure. That it's not something where a person can jump the waiting list because they are in need or they are a mainstream voucher, depending upon how your preferences set up. So a person may have, or a housing authority may have a disabled preference, and it could be category number 5. That's up to the housing authority. The housing authority adopts a mainstream voucher preference. It must identify that, make sure everybody is sorted and resorted correctly within those things. This slide here, I will resend out because I had an error on it and I was missing a word. But the housing authority cannot set up a separate voucher list. It has to be of the same list. So how people apply must be with everybody else. If there's no preference involved, there's no preference involved. If there is a preference involved, then they must be sorted correctly. It's not a separate list. It is, that funding is separate, but the list is all together. Another question I've had recently was, does the landlord notice any difference? And no. Most of the time it's the same work as a housing voucher. It might be that the landlord notices that caseworker might be involved, might be helping them apply, work with them on things. But it is something which, people have to realize supportive services are not necessarily daily cares and other things. They could be a whole lot of other things. But overall, to the landlord, this is the same voucher that's going along. So supportive services are things that we talk about often, and we want to make sure that people are understanding of what supportive services are. Supportive services help connect housing and the support services. We need to help keep that person housed. We need to reduce on any evictions or issues. How is it that the person, takes care of themselves? It does not necessarily mean daily cares or corrections. It's that they're on parole, or that they're severely mentally ill. That doesn't necessarily mean supportive services. Supportive services can mean financial, can mean budget, can mean counseling. It can mean that the person's got a payee, or going through financial counseling or other counseling. It doesn't mean that that person has to have a physical body coming to help them out with things. There's a lot of different services that are involved with this. It could be employment services. That one I know is really stuck in a lot of people's minds. When we mention supportive services, immediately the person's thought is, well, they're a felon, or they're in rehab, or they're coming out. That is not necessarily the case. Supportive services are a lot of things, and we need to include those within that housing equation. So it is something where we're matching up some of those things and trying to make those connections when we're working with that client. And especially if they've got a caseworker, they may not have one. But hey, if there are some services available, how can you relate some of that information to them? One of the easiest ways that we've done some of that too is also to have them call First Link or 211 to connect with other services in the area if we're unaware of what they may need. So some things to know. As I mentioned, the waiting list, the supportive, or the mainstream vouchers have to be part of the same voucher waiting list. And so if somebody's waiting list is closed, they are not going to take any new applications. So even if there are lots of mainstream vouchers out there, that housing authority has to go through their waiting list and make sure it is, they go through everybody in order. And then they can reopen things up when that housing authority feels that they can. These are hard to house clients and sometimes need a lot of casework. They sometimes need a little bit more explaining on some of the policies of housing and how to apply and get things through. One of the things that we've ran into is that criminal history policies differ, and that can cause issues with clients. And so we've, asking a client if they wanted to move from here to another county, the other county may not accept them. They may not have a waiver in working with that, but also that the landlords have their own screening. No matter what a person does or what program, landlords do have the right to protect their property, and they also have the right to protect their clients. We always, that is all to be aware of and to make people aware of. Even if a housing authority gives you a voucher, it doesn't necessarily guarantee you housing. The other, very much so, I keep going, that people do not understand HUD's definition of disabled. And I honestly have worked with victims of domestic violence and put them through on this human trafficking, substance abuse, and other disabilities. Having them complete that verification form, that gives you very good evidence of that they are disabled. It also gives you a great audit trail. If HUD ever came back or your auditor is looking, well, was this person mainstream or not? Very early on when they started the mainstream program, HUD did do audits, had you submit everything back, who was qualified and stuff. And that's something that a person needs to be aware of. And I have, other housing authorities, if they've understood that it is a normal voucher, you don't have to have the program to accept a mainstream voucher client. So to your area and you don't have that program, it doesn't mean that they're, pushed away. They are a normal voucher. But this is, the key to so many things are creating those relationships with casework, with other supportive services, and trying to make sure that you're housing people properly. It does take time to grow at times. So again, building that relationship and getting the clients to apply, getting them through that process takes a little bit of time. And obviously, it has made a lot of complications to things, as we have dealt with change every week from the feds on how different programs are working or different guidance that we're getting. It can make a lot of things complicated. It does take a little bit longer for some staffing and client issues. Like I said, trying to work through that, making sure different documentation is there, mainly because you want to make sure that everybody is housed properly and making sure that those verifications are done properly. The mainstream voucher clients are going to use up more housing assistance dollars than a normal voucher client. They typically do not have a sustainable income, or we may have a lot of them. If they're coming out of institutional care, may not have any money, they may not have deposits. So they're going to use up housing assistance a lot more. So if a housing authority applies for mainstream vouchers, to make sure that you're building that into your budget. A big issue that a lot of people run into is not having the vital documents. There are some websites and some other areas that people can help get vital documents. And just a heads up that the CARES dollars for some of the housing authorities and others can help with those documents. The other part I will really emphasize is needing the proper releases of information. There's a lot of issues we've had and ran into where one agency and another do not have the proper releases, or you have somebody calling wanting to represent or help somebody. You need to have that proper release of information and make sure it's accepted. These funds have to be tracked separately, and that has caused some issues, but they have to be tracked. And housing authorities can use them as project-based vouchers. That helps create those permanent supportive complexes. It helps attract some different types of developments or some different types of solutions in your community. Again, the waiting list preferences must be followed. There's no waiting list jumping just because a person is mainstream. The other thing or that they get evicted or anything like that, I don't know who all is on, but one of the things that I have had talks with court judges on is if there was an issue ahead of time, you needed to, the case should be that you should person to apply for housing assistance long before that you've signed an eviction or served any other papers. Just because you've signed that doesn't push them up. And just because a judge calls me, which has happened, doesn't mean I push them up on the wait list. The wait list is the wait list. It's controlled, it's something watched very heavily by HUD. The federal government controls the funds and any increases to the mainstream voucher program. And HUD sets that rent standards for housing authorities, which those authorities, the fair market rent documentation is out for 2021. So do check that out. The new rent standards are out there. A key to helping many of the mainstream voucher clients is making sure that you have your own policies available, but you also have those forms. So the verification of that form is readily available, especially to those agencies that you are working with. You should also make available the minimum rent waiver. Again, this typical type of household may not have any sustainable income, so make sure that you can look at waiving any minimum rent waivers. Follow your policy, see what's in your admin plan, make your form to match that. The other one is reasonable accommodations. And have a form ready that people can fill out, check what it is, what they may need for reasonable accommodation. Always ask the question every year, make sure that if there's anything that's changed in the last year to provide any new reasonable accommodations or different reasonable accommodations. If you apply for these, or housing authority applies for these funds and gets them, make sure that your policies meet what it was that you applied for. That's always a big thing to follow up on, and things from grants.gov. Casework in partnership absolutely vital to the success of a mainstream voucher program. Just like they are with any other program, working together with a lot of different entities. Doesn't mean you have to become an expert in knowing what behavioral health things are, but it means that you should be an expert in knowing how to pick up the phone and ask some questions and help direct somebody in that way. We have worked with a lot of different entities across the state and at times across the country, being able to provide these mainstream vouchers and help those people in need with the absolute vital thing of housing. Again, my information is up on the screen. If there are questions that you do have, and you may not want to ask them outright on this, you can send me a direct email, david@greatplainsha.com, and we'll certainly go through and try to help answer any questions. As I say, I'm an administrator of the program. I'm not an expert on it. There might be something if you, I may have to check with HUD on some ideas here, but that's my presentation. And I guess check to see if there was any questions.
Thanks, Dave. There are a few questions.
Okay.
The first one, how many vouchers are available for North Dakota?
Hello, this is Tony with Long X.
Yeah.
I thought we had a 9 o'clock appointment today.
Oh, somebody's on.
The phone sign was up.
Yeah, but that wasn't until like 11 o'clock.
Can you mute your microphone, please?
What?
Hold on.
I started at 5 o'clock, so I took an early lunch.
I don't know who's talking.
Somebody is on the phone or on the presentation, please mute. Did that take care of it?
I think so. I've muted. Okay. So the first question was, how many vouchers are available for North Dakota?
Let me look this up. So the last update we had for North Dakota, the mainstream vouchers did not include, well, this is as of June 2020, was 371. 371 does not include an extra allocation that came underneath the CARES Act. So I'm thinking it's actually closer to the 500 mark, actually. But 371 was what was June.
Okay. The next question, does a TBI diagnosis qualify a person for a mainstream voucher?
What is a TBI?
Terminal brain injury.
Traumatic brain injury? Yes. It's a permanent disability. So yes.
Okay. The next question is, how can people in rural areas be a part of the mainstream voucher if it is not available in their region?
They would, they can look at if another area that has mainstream, if they have the immediate portability and having a person apply there to port out. So be checking with those other housing authorities what the availability is.
Let's see where to go. How many of the 371 have been assigned?
So that was, again, June 2020 was the last update I had from HUD. Out of 371, 222 were leased up. And I know that's changed dramatically since then. I mean, even my own housing authority, we've, I think, added 20 in that time period.
Next question, does South Dakota have any?
No, there are no housing authorities in South Dakota with mainstream vouchers. In fact, I'll double check that right now. There are none, according to HUD's website.
Do you know how many vouchers available currently?
No, offhand, that'd be kind of difficult. Being it's always fluctuating, and I know housing authorities are actively trying to lease. So, I mean, that would be really hard to say how many are actually open. But it does, I mean, like other vouchers, it does take quite a few people going through that wait list to get that single client. So, you know, it can take a bit.
Just double check them all here.
I will add that the mainstream voucher, there was a special allocation from the CARES Act, and the housing authorities all had, those that had existing programs were allocated additional vouchers. We didn't have to apply for them. You were allocated them, and the housing authority decided on when those vouchers would kick in. And so in addition to the 371, we had every housing authority got, or I think got some additional ones. And that kind of a big, probably bigger discrepancy of what's being used and what wasn't is because all of a sudden there's a special allocation from Congress. Everybody is actively out trying to utilize the vouchers. The other component about this too is HUD awards grants based on some of the use. So the housing authority must show that it has been using 80% of either the funding or the number of leased up vouchers in order to get new vouchers, or that determines how much they would get used. Everybody is out actively trying to lease up the mainstream vouchers.
That seems to be all of the questions.
Oh, Kylie, we've had a couple more come in.
Oh,
I can read it. If mainstream is ported to a housing authority without mainstream, does that mean that it is now a housing choice voucher and our housing authority can issue another mainstream?
If the other housing authority takes that one on, absorbs it as a normal voucher, you will have another mainstream. That voucher ends. Yes.
And then, Dave, I have a couple questions for you.
Sure.
If a housing authority has their wait list closed, will they still accept a mainstream voucher that's ported to them? I think you covered it, but I didn't catch it.
So no matter what, the housing authority always has two options, either to absorb or to bill that other housing authority. So it is up to them. If they have mainstream vouchers open, they could absorb that one, so they use their list. But it is all up to that housing authority what they want to do, if they're going to bill or absorb. It's going to be their financial.
Okay. Then my other question for you, when you talked about documentation for the disability for your audit, if a person is using a wheelchair, do you still need the documentation? Fair Housing had said that you shouldn't ask for any documentation, and so.
Well, so here's the ruling on what we would go on this, is that you were asking for a special preference. And so you can ask, because what HUD is saying is it has to be a permanent disability. So if you rolled up in a wheelchair, do I know, is that a permanent disability or is that a temporary disability? Was your leg broken, or is there something wrong that creates a longer term disability? you are asking for something that is, you know, a special voucher or preference, and so then that you can ask the verification for.
Okay, and then we've got a follow-up on the porting of the main. Do we have to have the verification MS5 category or just a disability verification?
So if it's a porting one that's going to, you know, if the person goes from Jamestown here in Great Plains and went up to Devil's Lake at North Central, we've already gone through and having to verify that that person is disabled, has that verification in the MS5. The housing authority that is sending that information should include that with the packet, sending that information so that the next housing authority has it. It'd be just the same as verifying the income and other items.
Okay, and then there's one more. So in addition to the age and disability criteria, do they have to meet one of the other criteria, such as transitioning out of an institutional setting or other segregated setting?
Yes, they should be meeting those criteria, that they are institutionalized or at risk of being in either one of those, at risk of being homeless or chronically homeless. And like I said, a lot of times with the income based on I'd say in generalization, when you look at that type of household, they're going to be generally at risk of homelessness.
Then we have a follow-up. So we initially had to verify the MS5 categories.
I missed part of that.
This is a follow-up to the one about the MS5 and the sent. So we initially have to verify the MS5 categories. What kind of verification can we use for those?
So depending on where they're applying from. So we've, you know, having people that have applied and have information working with their caseworker that they are indeed in, you know, the state hospital, or a caseworker working with somebody that is coming out of, you know, nursing home care or segregated setting. That type of documentation is great. So if they're working with one of those facilities, any of the, you know, caseworker, doctor documents that they're at risk of being and going into those. At risk of being homeless, I think is that one, you know, person demonstrating what their income is versus what their rent. It's easy for anybody to become rent burdened and end up becoming homeless on a very, very limited income. The chronic homeless, that one, there's a lot of things. I can't really get into too much on that one because I haven't really seen it much. But I know other housing authorities do. And for that, I probably defer to, you know, the homeless coalitions and those to check out if they've had a long-term chronic homeless issue.
Okay, and it looks like there's one more, and you've kind of answered this one, but how is at risk of homelessness verified?
Well, so here's a couple of them. The income is one. The other is, are they current? So we've, I've actually dealt with some families where they've been living with another family, and that has put that family at risk of, or both families at risk of being evicted. There are some of those things where you can ask questions and try to re-verify back. The at risk of homeless, I think, is a big blanket one that most people are going to check and most people are going to utilize. But that is probably the most common one, and that it's harder, that we don't have a ton of verification on some of them, but we know by the income that they're at risk. Documentation of family, caseworker, or others that provide.
Okay, and that looks like it is it for all the questions.
Awesome, and I end up being done just right at 2:30. So thank you everybody for being on. I thank everybody for the opportunity to be speaking today. If you do have questions afterwards, feel free to send me an email and I'll certainly do my best at answering them.
Okay, thank you so much, Dave. Thanks everybody for joining in today.
You that need like a participation certificate, email or contact Marilyn and she will get that for you.